Hello, it's me Durga Pokral and my student ID is 22068412 and my topic is cultural influences on health behaviors in Aboriginal Australians. I acknowledge that we are meeting today on the ancestral land of Aboriginal peoples. I respect their deep-rooted connection to the land and their community, and I extend my respect to elders past, present and emerging. Today, I am going to discuss about the health of the Aboriginal people, a vital cultural group in Australia. Today, I will also be presenting how the cultural beliefs and practices affect the health behaviors of Aboriginal people in Australia. I will also discuss the two main health issues, which are mental illness and cancer faced by the Aboriginal Australians. In addition, I will explain how well the present healthcare policies handle this problem and will mention two recommendations for raising the standard of services. And now I'll slightly discuss the background. Aboriginal people are the original occupants of Tasmania and mainland of Australia, which are over 0.5 millions. They have a rich cultural history that encompasses several languages, customs, and spiritual practices that are closely linked to the environment. There is a significant health inequalities despite of the rich cultural history. In order to overcome this gap, it is very crucial to comprehend how their cultural beliefs influence their health practices. So now I'm going to discuss about the impact of cultural belief on health behaviors and practices. The Aboriginal people of Australia have a strong cultural belief that impact their health-related behaviors and attitude. An integrated approach to physical, emotional, and spiritual well-being is frequently emphasized by religious groups. For example, Aboriginal people believe that social relationship, ancestral spirit, and the land are all related to the health. Now I'm going to discuss how the impact on mental health treatment. Cultural beliefs plays a significant role in experiencing mental health illness. This belief may be delayed the normal treatment process of mental health. Indigenous people overall mental health has been significantly impacted by the history of colonization, especially by the trauma of the stolen generation and ongoing experiences with prejudice. Substance addiction, suicide, and severe degree of psychological suffering have all resulted from these events. But a lot of people are afraid to ask for treatment because of societal perception of shame and the stigma associated with mental illness. Similarly, for the Aboriginal people, cultural beliefs have a major impact on their experiences with and response to cancer treatment. Because cancer is seen to disturb the balance within the community and spirituality, it is frequently considered with considerable fear and shame. Due to the related embarrassment, people may choose conventional healing technique or put off revealing their diseases, which may delay getting a diagnosis and receiving treatment. A strong distrust of the healthcare system is another common issue that arises from past and present injustice and may discourage people from engaging in cancer screening program or performing the recommended treatment. When compared to the non-indigenous population, Aboriginal people have worse cancer outcome because of their cultural barriers, financial disadvantage, and geographical isolation. Now I'm going to discuss about the health issues. At first, I'm going to discuss about the cancer. Cancer is the second most cause of death worldwide. In Australia, five most more common diagnosed are lung cancer, breast cancer, bowel cancer, skin, and the prostate cancer, which is over 60% of all cancer diagnosed. Survival rate of Aboriginal population from all cancer is 48%, which is lower as compared to non-Aboriginal population, which is about 59%. Some of the variables that contribute to poorer outcome from cancer among Aboriginal Australians include advanced cancer rate diagnosis, less cancer survival, limited access to therapy, more comorbidities, low socioeconomic position, and language obstacle. And their outcome are frequently worse because they receive diagnosis later in life and are less likely to participate in cancer screening program. Now I'm going to discuss about the mental illness. Mental health is another important health issue in Aboriginal population. There are different types of mental illness, which are anxiety, schizophrenia, suicidal ideation, depression, substance abuse. Among them, depression and anxiety in Aboriginal population have greater risks between 50% and 3 times higher than for non-Indigenous adults. Whereas rate of substance use, which is 12.2% in Indigenous population, is also higher as compared to 2.6% of non-Indigenous population. population. Poverty, unemployment, low educational status, adverse life effects, housing are the example of social and economic disadvantage that worsen mental health and is experienced more in the Australian Aborigine. If there is not availability of mental health treatment, then the condition will be worse, especially in the rural areas where less availability of health services are available. Therefore, availability of health service in rural areas in promoting education and mental health is crucial to prevent further outcomings. Now I'm going to discuss about the effectiveness of existing healthcare provision. The Australian government has introduced a number of programs to reduce the health inequalities that Aboriginal people experiences. The National Aboriginal and Torres Strait Islander Health Plan 2013 to 2023 is a crucial framework and attempts to offer a true and evidence-based method for enhancing health outcomes. So now I'll talk about the cancer care. To enhance cancer outcome for Aboriginal people, programs like the Aboriginal Cancer Journal strategy has been established in the field of cancer care, offering culturally appropriate support services at every stage of the cancer care process, from early diagnosis and prevention to treatment and palliative care, is the main objective of this approach. Even though this initiative have demonstrated promise in terms of enhancing patient outcome and experiences, resources constraint and accessibility issues are frequent problem for them. For example, access to specialist cancer treatment facilities may be difficult for many Aboriginal people living in rural areas, and culturally sensitive care in metropolitan areas may not be uniform throughout the healthcare system. Now let's discuss about the mental health care. The social and emotional well-being framework is a significant effort in the field of the mental health that aims to incorporate cultural conception of health into mental health care. This model acknowledges Aborigine and Torres Island people holistic perspective on health, which include not just physical health but also mental, social, and spiritual well-being. In order to address mental health crisis in indigenous communities, it is imperative to culturally relevant mental health programs and services be developed. The social and emotional well-being framework has led this process. However, there have been uneven application of even programs, and many communities continue to lack access to mental health care that is culturally sensitive. There are few mental health professionals, especially in rural regions, which are aware of often respectful of indigenous traditional conditions. Moreover, the efficacy of this treatment is still being undetermined by structural obstacles like racism and prejudice inside the healthcare system. Because of this, a large number of Aboriginal people do not obtain the necessary mental health care. Now let's discuss about the strategy for improvement. At first, I will discuss about the improving cultural competency in healthcare is very important for the improvement of different kinds of illness, which are ensuring cultural competency among healthcare personnel is crucial step toward enhancing healthcare quality. This implies that healthcare workers, including physicians and nurses, are educated to recognize, honor, and collaborate with indigenous population traditions and beliefs. Healthcare professionals may give treatment that patients feel comfortable and respected by learning about indigenous perspective on health, particularly the significance of tradition healing methods. Indigenous patients are more likely to trust healthcare providers and seek early treatment, especially for serious conditions like cancer and mental health difficulties. Now, another is expanding access. Another vital strategy is to guarantee the availability and accessibility of culturally competent healthcare services in isolated and rural regions where a population of Aboriginal people reside. Increasing financial for Aboriginal community controlled healthcare or healthcare administered by Indigenous people for Indigenous community may be one of the achieved. These services are renewed for offering treatment that is more in line with the community's cultural requirements and values, which improve health results. I'll discuss about the recommendation which I mentioned before. It helps to improve cultural competency among healthcare workers and expand access to culturally appropriate services. Another one is conclusion. In conclusion, an integrated strategy that places a higher priority on cultural competency and accessibility in healthcare is needed to address the health inequalities that affect Aboriginal and Torres Island people. Even if current programs have been progress, there are still large gaps, especially when it comes to providing mental health and cancer patients with care that is culturally relevant. Therefore, building trust, promoting early participation, and eventually improving health outcome for Indigenous people is very important in order to have good health outcome. And these are the references. Thank you so much for listening. Thank you so much.